Hello, everybody. We're live. Um, my name's Crystal. Welcome to the channel, Real Lady Electrician, and it's Wellness Wednesday. We usually talk about mental health, but today I want to talk about physical health and how it can affect our mental health. Um, my friend who gets migraines is going to pain management, and I'm curious to see how that is going to work out or help her out. So, yeah, so I thought that's what we'd talk about today. So, I don't have anything pulled up on the. Let's look up my or pain management. Pain management. Are you serious? I have my um, I have my computer on a box, and my cat just went inside the box. So silly, so silly. Um, so we're gonna share the screen. I'm gonna have to get my glasses. Paint management. Share the screen. Okay, let's go back here. So let me get my glasses and because I'm gonna be reading a lot. So I have one friend, you guys know Jamie. She's been to pain management, but she doesn't live in Michigan. So I was curious as to how they'll deal with it here as opposed to where she's been in Pennsylvania and Indiana. What does that say? Oh, okay. And are you serious right now? I'm going to turn you guys around so that you can't get in here. What a bad kitty. He didn't want anything to do with the box till I put my till I started talking to you guys. Yeah, it's Ronan, the big guy. He's just being a booty head. Um, so yeah, so I don't know anything about pain management. I have never been. Um, I'm using over the counter stuff right now for my arthritis, and it seems to be working. I'm pushing off any type of pain management, like pushing it off as long as I can handle the pain. So I added Voltaren, which is something I've used before, but I ran out of it, so I never replenished it. But it's gotten to the point now where I need something in addition to um, just whatever else I'm doing. So, like the TENS unit, that helps a lot, and that helps me sleep real good. And then just the medications that I'm on. And I do go to the rheumatologist next month, so it would be great for them to have some ideas about what to do for the pain. Um, wouldn't it be awesome if they could just inject your joints and you could just be like you were when you were 20? I wish that's what they had, and I don't understand why they don't have it. But anyway, so I was talking about my knees. So I have osteoarthritis, and I'm going to the rheumatologist, and I've added another, I would say, a pain management item, even though it's over the counter. I used to get these lidocaine patches, and I was working at the time, and man, those things were really good. They would stay on real good on your knees, and they just lasted a long time. I love those, but my insurance does not cover it now that I don't have private insurance, Medicare. I haven't tried through Medicaid, but no, Medicaid didn't cover it. I don't know if Medicare covers it. I guess that's where I'm at. So that's what I was looking into trying again. I'm going to see the doctor next month as well, my regular doctor. And so I'll talk to her about that too. Um, so, yeah, I just want to know, have you been to pain management? Do you know what it is? Can you share about pain management? And what types of pain do you deal with, and how do you deal with it? How do you cope with the pain? Um, so, yeah, that's what we're talking about today. Physical ailments. Like, like I said, I have osteoarthritis. And then you guys know I cough all the time. That's just, I don't have any lung issues or anything like that. I just cough all the time. So, the sun is going up and down, so that's why my lighting is weird. And okay, so let's go ahead and check out this page here. So of course there are some advertisements, sponsored results. Corewell Health, use our doctor finder, places for pain management. Okay. Things to know. Things to know. That's what we want to know. I guess types. Okay. Pain management includes a combination of pharmacological medications, interventional procedures, physical and psychological therapies tailored to the type and severity of pain. These approaches aim to reduce pain, improve function, and enhance quality of life, ranging from conservative care like physical therapy and medication to minimally invasive procedures and alternative therapies. Types of pain management. Pharmacological management, medications, over the counter, acetamin, I use naproxen for mild to moderate pain. I haven't started with opioids yet, but I'm sure that's on the thing. But I don't do well with opioids. Talk about constipation. I know if you're new here, I don't usually, I just use regular words. So constipation. So that's why I don't like opioids. Topical agents, creams, ointments, or patches applied to skin. That's what I'm looking forward to using, because I use the naproxen, and I know you're not supposed to take any of these Tylenol or any of this stuff all the time. So I do. I am more interested in the creams and ointments and patches. But that's me. Let's see. Nope, nobody's here. Okay, so I'm gonna just keep reading. And interventional pain management procedures. I know physical therapy. Now, I know nerve blocks, injections to block pain signals from specific nerves. I know, I don't think Joe is here right now. She hasn't been feeling well, but um, she has had nerve blocks. I think so has Shelly. And I don't think anyone else has really talked about it. Epidural steroid injections used for radicular pain, nerve root pain. Radiofrequency ablation using heat to temporarily turn off a nerve's ability to send pain signals. Spinal cord stimulators, peripheral nerve stimulation, implant devices that use electrical impulses to interfere with pain signals. Those are a lot more advanced as far as pain management goes. Now, I had knee surgery because there was nothing they could do other than surgery for my knee. That's what I was told. I was told they're so bad, just from being an electrician, that there was no treatment. Now, we tried the lidocaine shot, and I don't think it lasted a day. So I had the surgery. It was horrible. I mean, I did well through the surgery, but the recovery at that time I had private insurance, so actually a lady came to my house and helped me with my first 2 weeks of physical therapy, which is what I think made a huge difference. I have mobility in this knee. I cannot kneel on it, but it can go back and forth. And if I walk around too much, it will become painful. When I talked to my surgeon, he said that's just what happens sometimes. Like some people get knee surgery and they're like running marathons and stuff, but that did not happen for me. So I'm afraid that the same thing is going to happen with the other side. And I can only kneel on the knee that doesn't have surgery. So if I'm trying to get my booty up from the floor, then a lot of you know when we get down on the floor, we got to make sure there's some way to get up. There's got to be some way to get up, or we just don't get down on the floor. And so I'm afraid that if I have this knee done, I won't be able to kneel on it either. And then if I'm on the ground for whatever reason, I won't be able to get up. So that's a fear of mine. That's just a personal fear. That's not grounded in any type of reality other than my experience with the surgery. So with this knee that hasn't had surgery, I'm just doing pain management basically for that. So the rheumatologist, I'm going to the rheumatologist. I started having difficulties in my hands this year, right here. And then when we were having storms back and forth, like my fingers, I couldn't move them. They hurt so bad. And so I did make the appointment finally with the rheumatologist, and hopefully they'll have some better news for my hands. And also I have it in my feet. I have it on the top of my feet. I think that's from all the years of metatarsals, 20 years wearing steel toes and metal tarsals where the metal comes up the tongue and it's right on top of your foot. Those were, once they started doing the Kevlar tongue, it was way better. And but all those years of just having the metatarsal in there just really affected the top of my foot and my toes. And I think the toes are linked to the fingers maybe. So they're not horrible yet, but I still I get sharp pains from that in my feet. So that's my medical pain history right now. I did have some kidney stones a couple years ago. And I'm going through right now where I'm just not wanting to eat anything. Or if I do, it's going to be something that's cool. And I think it's because of the heat. And also because of the allergies. And I'm just losing focus a little bit. Because the nausea comes and goes. That's why I'm not drinking coffee. And like waves. I don't know if it's just the sinuses. It's not cyclospiralis, if I'm saying that right. That's in Michigan right now, the thing with the lettuce. It's not that. I don't usually get iceberg lettuce. Yeah, just give me a second. So yeah, so my husband's worried that because I'm not wanting to eat, it's kidney stones again. But it was just this year, maybe like January. They did some testing to see if I had them, and I didn't. Because when I had the kidney stones, I pretty much, if I ate anything, I would get sick. So I pretty much stopped eating. That's when I lost a lot of weight. I don't remember if I was on any lives at that time. I don't think so. I think I was like so sick. I could barely get out of bed. I thought it was the flu that just wouldn't go away. And when I finally went to the emergency room, it was kidney stones. I was like, really? Because I thought it was something in my stomach, not in my kidneys. Yeah. So, yep. So you just never know until you go. So it got so bad that I just couldn't handle it anymore, and I had to go. So I was in the hospital for about 4 days. It was New Year's. I was in the hospital for New Year's that year, and that's been about 2 years ago. And yeah, so he's worried that that's what's going on with me not eating. But I told him I don't think that's it. I think it's allergies and I'm stressed, so I have a lot of stomach acid. I've been taking some Prilosec for that over the counter. Um, and that helps. That does help. It's the one that has omeprazole and it's got like a little bit of Tums in it. Have you seen the combination? That's the one. So, yeah, there's that. But I am, if that happens, if I start getting sick again, then I'll go to the emergency room much sooner because I know the signs. So there is that. Um, so let's see. No comments today. I know it's in the middle of summer and everybody's busy, so I didn't expect a lot of people. Okay, so let's go back to pain management and let's look at physical and rehabilitative therapies. Excuse me. Exercise and techniques to improve strength, mobility, and function. Physical therapy. Massage therapy to reduce muscle tension and pain. Now, the only thing with that is you have to be able to be touched and not be in pain. And so that's a problem for a lot of people. So you can't get a massage because when they touch you, it hurts. So hot cold therapy, applying ice and heat to reduce inflammation and relax muscles. Transcutaneous electrical nerve stimulate using electrical currents for pain relief. TENS unit. I love that thing. So alternative and complementary therapies. Acupuncture, inserting thin needles into the skin to release energy and reduce tension. Chiropractic care, manipulative therapy, adjust to the spine or soft tissues. Mind-body techniques, meditation, yoga, guided imagery, and deep breathing to reduce stress-related pain. Biofeedback, learning to control bodily functions like heart rate and emotional tension to manage pain. Now, I don't know much about biofeedback. Psychological support. Cognitive behavioral therapy, counseling to change how patients think about and deal with pain. Support groups to help manage the emotional impact of chronic pain. Considerations, pain management often involves a multidisciplinary team to combine these strategies, particularly for chronic pain, to minimize risks associated with medication reliance and maximize functionality. Let's see. So let's see. Latest advancements. Let's see this. Latest advancements in pain management focus on non-opioid solutions and personalized care, including AI-driven neuromodulation, spinal cord, peripheral cord stimulation, regenerative medicine, PRP, stem cell therapy, and non-addictive drugs like Jornavax, innovative technologies like virtual reality and smart wearables, also known for pain modulation and tracking. Key advancements and usage examples. Non-opioid medications and biologics. The FDA approved Gervanax in early 2025 as a first in a new class of non-opioid analgesics to moderate to severe acute pain. Additionally, long-acting local anesthetics like liposomal Exparel is the brand name, are used for post-surgical pain. Advanced neuromodulation, modern spine cord stimulation, and dorsal root ganglion stimulators now use artificial intelligence to adjust stimulation automatically based on patient movement and activity levels. Peripheral nerve stimulation acts as a temporary non-implanted bridge for targeted pain relief. That's very interesting. Let's see. Regenerative medicine, platelet-rich plasma injections, and stem cell therapies are used to promote tissue repair and manage chronic pain in joints, ligaments, and tendons. Okay. Digital health and AI virtual reality is increasingly used for therapeutic distraction, neuro reprogramming, and treating complex regional pain syndromes. Wearable biosensors and AI analyze patient data to offer personalized pain management plans and identify patterns. Targeted neuroablation, radiofrequency ablation, uses thermal energy to destroy nerve tissue responsible for transmitting chronic pain signals, particularly for back and joint pain. These advancements target reducing addiction risk while improving long-term outcomes for patients with chronic pain. What not to tell a pain manager? Avoid demanding specific medications. Like nothing works. The statement can trigger red flags for drug-seeking behavior and appear non-compliant. Instead, clearly describe your daily functional limitations and how specific activities impact your pain. Experts in pain medication highly recommend avoiding the following. Demanding any specific drugs. Saying my pain is 10 out of 10 all of the time. Stating I can't do anything. Hiding other treatments or supplements. Never conceal alternative therapies. Rejecting therapies without giving them a fair try. Quick limit your options. Gives the impression you are looking for a quick fix. For more on what to prepare for your appointment, you can review the Verywell Pain Management Contact Overview to understand what is typically expected from in the pain management settings. What qualifies you for pain management? To qualify for specialized pain management, you typically need persistent pain that interferes with daily life, a diagnosable pain source like sciatica or herniated disc, and a history of unsuccessful conservative treatments. If your primary care provider feels uncomfortable managing your medications, or if you reach high opioid thresholds, a referral is strongly indicated. Who is a candidate? You may be considered for specialized intervention if you experience unresolved chronic pain lasting longer than 3 to 6 months that has not responded to over-the-counter NSAIDs or physical therapy. Specific medical conditions, diagnosable sources of discomfort such as spinal stenosis, peripheral neuropathy, arthritis, or failed back syndrome. Severe limitations, pain that severely impacts your mobility, sleep, or ability to work. Specialist qualifications. If you're asking about what qualifies a doctor to practice pain management, they must undergo extensive, rigorous training. A qualified pain specialist must hold a medical degree, residency training, fellowship, 1 to 2 years of specialized fellowship training in pain management. Board certification, certified by the American Board of Medical Specialties or the American Osteopathic Association in pain medicine or related subspecialty. To explore treatment options or find a board-certified specialist, you can use the American Society of Regional Anesthesia and Pain Medicine, ASRA, Pain Medicine Finder to consult with your primary care provider for a clinical referral. What are the 4 P's of pain management? Oh, let me go back and see if anybody's here. Nope, it's just us. Just me and you who's here. Okay, let's go back and read some more. Okay, 4 P's of pain management. You know, I really think it's my sinuses because the nausea is worse. I forgot to take my medication last night. I fell asleep before I did, and that was a bad move for me. So I'm not having a lot of the coughing, but I am having a lot of nausea right now. So It's almost 2. I may have to do a short one like I did last week. Oh, there's my husband. Hello, I'm live. Thank you. Okay. I did not make coffee. The 4 P's of pain management refer to a multidisciplinary, multimodal approach to treating chronic pain. That includes physical, movement therapy, psychological, mind-body strategies, pharmacological medications, and procedural medical interventions. Okay. Focuses on restoring function, mobility, and strength. That often involves physical therapy, targeted exercises, massage, and gentle movement to prevent the muscles guarding the deconditioning associated with chronic pain. Psychological, address the emotional and mental toll of living with persistent pain. Techniques like cognitive behavioral therapy, acceptance and commitment therapy, mindfulness, and stress management help retrain how the brain perceives pain signals. Pharmacology utilizes medication to reduce pain intensity, allowing individuals to engage more fully in physical and psychological therapies that can range from over-the-counter NSAIDs to like ibuprofen to nerve pain medications or muscle relaxants. Okay. Procedural includes targeted medical interventions for pain that does not respond to conservative measures. Common procedures include epidural steroid injections, nerve blocks, or radio frequency ablation. Related framework, everyday activity management. Alternatively, if you are looking for strategies to cope with pain and fatigue in daily life, healthcare providers may also use a different set of P's. Pacing, balancing activity with regular rest breaks to avoid overexertion and pain flare-ups. Prioritizing, decide which tasks are most important and letting go of or delegating less critical activities. Yeah. Planning, breaking larger tasks into smaller chunks and organizing them for times when your energy levels are highest. Positioning, using ergonomics and changing body posture through the day to reduce strain on your joints and muscles. For comprehensive multidisciplinary approaches to building your personal care plan, you can explore resources and locate specialized care clinics through America's Chronic Pain Association. All right. What disqualifies you from pain management? What is the first line drug use for pain management? What stops nerve pain? What is the golden rule? Okay, what disqualifies you from pain management? Let's see. You can be disqualified from pain management or from receiving specific pain medications due to serious non-adherence to treatment plans, evidence of illegal or unsafe behaviors, or failing to show improvement. Testing positive for unprescribed substances or illegal drugs on 2 confirmed screens or being diagnosed with an untreated addiction will also disqualify you from controlled substance treatment. That makes sense. Common disqualifying factors include breach of patient agreement, missing mandatory appointments, refusing to undergo random pill counts or urine drug tests, or receiving pain prescriptions from multiple providers. Having prescribed medications missing from your system or having non-prescribed substances or illicit drugs present. Engaging in illegal activity like selling or sharing your medication, forging prescriptions, or exhibiting threatening behavior towards staff. Lack of medical necessity. Your medical records and imaging do not fully support the severity of your symptoms, or the treatment fails to provide adequate pain relief or functional improvement. Untreated addiction, current opioid abuse without actively participating in an addiction treatment program makes safe managing chronic pain nearly impossible. Unacceptable risk, pre-existing medical conditions such as severe respiratory issues that make opioid therapy unsafe. If you are discharged or denied care, the U.S. Pain Foundation advises that abruptly stopping medication can be physically unsafe. For more localized resources, you can consult your state's medical board website, which usually outlines specific guidelines for clinics and patient responsibilities. What is the first drug used for pain management? First-line drugs depend on the type of pain. Mild to moderate inflammation. Doctors start with NSAIDs, Advil, Aleve, Tylenol. For neuropathic pain, first-line options are usually anticonvulsants or antidepressants. The choice of initial medications change specifically on the root cause and classification of the pain. For instance, localized relief. Applying over-the-counter lidocaine patches or numbing creams offers the fastest numbing effect for flare-ups. Applying an ice pack for 15 minutes can dull nerve signals, while a heating pad can release muscle tension that compresses nerves. Standard pain medications like Advil generally do not work for nerve pain. For lasting relief, doctors typically prescribe medications that block overactive nerve signals, such as gabapentin, pregabalin, or specific antidepressants. If home remedies do not provide relief, consult a pain management specialist or neurologist. Excuse me. You can find highly rated local specialists by searching the American Society of Regional Anesthesia and Pain Medicine for interventional options like nerve blocks, which stop pain signals at the source. Okay. What is the golden rule of pain management? Show more. In clinical practice, the golden rule of pain management is pain is whatever the patient says it is and exists whenever they say it does. The principle dictates that subjective self-reporting is the ultimate and most accurate measure of pain, regardless of the patient's vital signs or outward appearance. The reported pain must be believed, documented, and addressed without requiring objective clinical proof. And a lot of doctors do not subscribe to that. A lot of doctors don't believe you have pain, or especially the older doctors, in my experience with a lot of my friends who have pain. Take it seriously. Failing to believe a patient's self-reported frequency leads to undertreatment, unnecessary suffering, and a breakdown in provider-patient trust. Absolutely. Individualized assessment. Since pain is deeply personal, it is best evaluated using standardized tools, such as 0 to 10, combined with assessment of how the pain impacts daily function. Compassionate communication. Providers are encouraged to use patient-centered communication and shared decision-making to ensure that the patient's perspective remains the focal point of the treatment. Providers are encouraged to use patient-centered communication and shared decision-making to ensure that the patient's perspective remains the focal point of the treatment plan. For a deeper look into compassionate care standards, you can explore the American Medical Association's Journal of Ethics. All right. It's still me and the one person that's here listening. Thank you. I hope you're learning something, because I am. What are the 5 diseases that could be the cause of chronic pain? Chronic pain, defined as pain lasting more than 6 months, often stems from underlying disease rather than just injuries. Common disease causing this include fibromyalgia is a disorder characterized by widespread musculoskeletal pain, fatigue, and heightened sensitivity to pressure. Osteoarthritis is a degenerative disease with the protective cartilage wears down, leading to persistent joint pain, stiffness, and swelling. Diabetic neuropathy, nerve damage caused by consistent high blood pressure resulting in burning, tingling, and shooting pain, usually starting in the feet. Endometriosis, a condition where tissue similar to the lining of the uterus grows outside the uterus, causing severe ongoing pelvic pain. Oh man. Rheumatoid arthritis, an autoimmune disease where the body's immune system attacks the joint linings, causing chronic inflammation, pain, potential joint deformity. I know that I think that we have at least one member that comes regularly in each of those categories. What drug is chemically? Why not? What is the old fashioned? What do most doctors prescribe? Vitamin. I don't know if there's a vitamin that takes away. Certain B vitamins are critical for managing nerve pain, specifically vitamin B1, benfotiamine, and vitamin B12. Methylcobalamin are most effective at reducing inflammation, supporting nerve cell regeneration, and repairing damaged myelin sheets. Vitamin supplements do not take away neuropathic pain in the same way an anesthetic or painkillers, but rather correct nutritional deficiencies and aid long-term nerve healing. Let's see. Let's see. B1, a fat-soluble form of thiamine that penetrates the protective nerve sheath better than standard water-soluble B1. Okay. Methylcobalamin, essential for neurologic function. Deficiencies often cause tingling, burning, and numbness. Always seek the methylcobalamin form, as the common synthetic form requires processing by the gut liver. Oh. ALA, alpha lipoic acid, a powerful antioxidant used to reduce burning and shooting neuropathic pain, often showing results within 3 to 5 weeks. Magnesium, the mineral, helps control nerve pain sensitivity and supports B1 absorption. Always consult your doctor before starting a high-dose vitamin regimen. How long does it take? Okay. Cleveland Clinic, pain management. What is its types, benefits, and risks? We've already gone over that, but we're going to check out the article. So, let's see what time it is. 2:08. Okay, so we're going to go till 2:30. If this article will last that long. Through a pain management plan, healthcare providers help you manage all kinds of causes of pain. Pain management approaches include medications, medical procedures, therapy, and complementary medical techniques. These plans help people with chronic pain feel better and improve their quality of life. What is pain management? Pain management helps you regulate pain with medications, procedures, exercise, and therapy. Pain management specialists may recommend one approach or combination of several. Prevent, reduce, and relieve pain. You may receive care in a pain clinic, your healthcare provider's office, or hospital. So you may not be going to a pain clinic or a specialist, but if you have severe pain, I would imagine that a specialist would be better than your actual regular doctor, and they would probably refer you at that time. Maybe not. So, okay, we're going to continue. Pain is the most common symptom of thousands of injuries and conditions you can experience in your life, and it can also result from treatments for conditions and injuries or be the main feature of a condition, a pain disorder. Pain can last a short time and go away when you heal acute pain, or it can last for months or years, chronic pain. Pain is very complex and everyone experiences differently. It's also not something we can see, and a lot of people have invisible conditions that cause pain. These factors and several others can make it difficult to seek help for pain. We've talked about that too. People not believing that you're having the pain that you're having just because you don't look like it. Um, those of us that deal with it are warriors, and a lot of people that I know have learned how to at least live with the pain. And yeah, you may be worried that others won't take you seriously or that the pain will never go away. Know that it's important to get medical help. No one should struggle through pain every day. Excuse me. Okay. Pain is, let's see. Pain is the most common symptom of thousands of injuries and conditions you can experience in your lifetime. It can also result from treatments for conditions and injuries or be the main feature of a condition, a pain disorder. Pain can last a short time and go away when you heal acute pain, or it can last for months or years, chronic pain. Pain is very complex and everyone experiences it differently. It's also not something we can see, and a lot of people have invisible conditions that cause pain. These factors and several others can make it difficult to seek help for pain. You may be worried that others won't take you seriously or that pain will never go away. Know that it's important to get medical help. No one should struggle through pain every day. Oh, I already read that. Depending on the cause and type of pain, it may not be possible to find total relief, and the pain may not get better right away. The goal of pain management is to improve your quality of life and functioning, like doing daily tasks, enjoying your usual activities, working in or attending school. Your provider or healthcare team will work with you to adjust your pain management plan so you can feel better. Who needs pain management? Anyone with pain, either acute or chronic, can benefit from a pain management plan. A comprehensive plan can help you manage pain that lasts a few days, such as after an injury or surgery. It can also help if you have long term pain from health conditions. Pain is a main symptom of a wide range of injuries, infections, and diseases. Some of the most common conditions that cause pain include arthritis and muscle and joint injuries, autoimmune conditions like Crohn's disease, lupus, and fibromyalgia, burns, cancer, causes of neuropathic pain like pinched nerves, peripheral neuropathy, and trigeminal neuralgia. That one I haven't heard of. The other ones I have. Chronic pain disorders like complex regional pain symptom and central pain syndrome. Circulatory disorders like peripheral artery disease, endometriosis, headaches and migraines, spine or spinal cord related conditions or injuries. Who do I see for pain management? If you don't know the cause of your pain, you might want to start with your primary care provider. They can start the diagnostic process and refer you to a pain management team or clinic. If you have a diagnosis, talk to your provider who managed the condition about starting a more involved pain management plan. You may have a team of pain management specialists who work together to help you manage long-term or severe pain. These specialists work in a field of medicine called algiatry. Your team may include algiatry, Algiatre, pain management specialists, anesthesiologists, specialists, and other medical conditions you may have, like oncologists or neurologists, nurses, mental health providers like psychologists and psychiatrists, physical and or occupational therapists, complementary or integrative health providers, social workers to evaluate the pain and the cause of it. Your team may recommend tests and assessments like physical exam, neurological exam, laboratory test, blood, urine, and cerebrospinal fluid test, imaging tests like MRI and CT scans, electrodiagnostic studies like nerve conduct studies or electromyography, EMG, how pain affects various aspects of your life, like your mood, your ability to do tasks and relationships and work. And pain does affect all those aspects. Oh, hey, Michelle. I need to put this as a reminder because we are on different time zones. Hi. Let me know. You said me. Is there something that you agreed with that I was reading? Um, and I'm only going to be on for a little bit longer, for like 15 more minutes. I still don't feel good. And I think today is my own fault because I didn't take my allergy medicine last night and I should have. I fell asleep and I did not take it. And so my tummy I think I had a lot of drainage last night. So I'm still feeling yucky. Okay, let's go back over here. What are the different types of pain management? Your healthcare provider or pain management team may recommend one approach or a combination of several pain management techniques. It may involve treating the underlying cause of pain and or managing pain as a symptom. Okay. How well a particular treatment works, varies from person to person, even for the same cause of pain. Providers technically start with minimally invasive or conservative pain management therapies before trying riskier ones, but there's no single right approach for pain management for all the people. Everybody's different. Your care team's going to be different. You're going to have different issues. So yeah, there is no like one size fits all pain management. This, and this, and you'll be great. There isn't one of those. I never believed that there was. So, at-home remedies for pain management. You may be able to relieve pain from injuries to muscles and soft tissue at home. Ask your provider about the RICE method: rest, ice compression, and elevation, and heat and cold therapy. Certain lifestyle changes can relieve pain. If you have overweight or obesity, your provider may recommend reaching and maintaining a weight that's healthy for you. Eating nutritious foods, drinking plenty of water, getting quality sleep, and managing stress may reduce pain. See, that's kind of a catch-22 because if you're in a lot of pain, it's hard for you to get good quality sleep and manage your stress, which I think not only increases your stress, but it also can increase your pain. So if you're at the point where that's not something you can do over the counter, for yourself, definitely I would go to pain management. Because when I can't sleep, everything is worse. I take a lot of medication for sleep, though, because of my mental health issues. Physical activity like walking or swimming or strength training may also reduce pain. These exercises can improve posture and help your body work better overall. They also benefit your mental health and help with balance. Talk to your healthcare provider before starting an exercise routine. Physical and occupational therapy for pain management. Okay. Okay. Psychotherapy for pain management. Talk therapy is a term for a variety of treatment techniques that aim to help you identify and change unhealthy emotions, thoughts, and behaviors that can help you manage or change how you experience pain. Because chronic pain can also lead to depression and anxiety, your provider may recommend psychotherapy and or medications for your mental health too. CBT or cognitive behavior therapy in particular can help you build skills to cope with the emotional load of experienced chronic pain and any associating mental health conditions. These skills may include addressing thoughts and emotions that can increase pain relaxation strategies and mindfulness techniques. Some people keep a pain diary to keep track of what makes pain better or worse. These details can help your provider plan treatment. Complementary medical therapies for pain management. Complementary medicine is a term that describes the types of treatments you may receive along with traditional Western medicine. Types of complementary medicine therapies that may include, okay. I see the first one is massage therapy, and that's only if you can actually be touched. And chronic chiropractic adjustments, the same thing. If you have any kind of spinal injury, you won't be able to use that. Acupuncture, I've never done, and I wonder if that is helpful. Biofeedback, meditation, breath work, yoga, reflexology, aromatherapy. I use aromatherapy all the time, dietary supplements, and herbal. When I was able to use my knees, yoga was very helpful in relaxation. I loved it, but I can't. I haven't tried the chair yoga, which I should. You know. And again, I don't know if the nausea is due to like overactivity this summer. I'm not relaxing and resting. I'm, running around. And my sister expanded. I forgot to mention that. So I'm helping her with the expansion. And just trying to take a day to do nothing, you know. It doesn't happen all the time. That's all. That's all. I complained about it last week. I'm not going to complain about it all the time this week. I'm complaining about my pain this week. Medical procedures and devices for pain management. I love my chiropractor group, but they aren't always good. That's true. I have chair yoga on my channel because the heat is disrespectful. Yes, the heat is. You have chair yoga on your channel. You mean you do chair yoga on your channel? Is that what you mean? Because that I should check you out on that. Like I'm not on YouTube a lot, but if you do have like a little class you're giving with the chair yoga, I would love to try that with you. Yeah, give me a little more information. And today we're having 70, I think they said 75 degrees today, and it's been good. Oh, okay, so I can look up the videos, right? I can look up the videos on your channel. So that's what I'll do. That's what I'll do. So if you hear comments from me, you'll know why. So I will look those up because I they do it here at the senior center, and when I have time in the winter, I don't want to get out, and so if I could do it here at home, I think that would be great. And all the ones I've seen make you pay for them, so I will definitely look up your chair yoga for sure. So thank you for that information. That makes me happy because I can do it while I'm sitting here, watching TV, and it will help with my. I don't have so much back pain as it's in my hip on the side that I sleep on, and that's just muscular. That's just from sleeping on the same side for 100 years, and so, but my knees, yeah, I'm definitely going to try your series, so I will definitely be doing that. Okay, so let's go back here. Medical procedure and devices for pain management. Now, this is stuff that a lot of the people that come to our Wellness Wednesdays have had done. Transcutaneous electrical nerve TENS. I have a TENS unit that I use. Peripheral nerve stimulation, spinal cord stimulation. A variety of medical procedures can help manage pain. Certain procedures use electrical stimulation of nerves and soft tissues. Other procedures and devices for pain management. Radiofrequency ablation, basovertebral nerve ablation, intraset procedure, steroid injections, nerve blocks. I know a lot of people here have had nerve blocks and the radiofrequency ablation and the Botox. My friend did the Botox for the migraines, which is what they have it for, and that was not helpful for her. So that's why she's going to pain management. Patient control, PCA pump, or Baclofen pump, and that we know Miss Jamie has. Surgery to address the underlying cause of pain, like spine surgery, for example. Most of these options fall under the approach of interventional pain management. It aims to help manage pain with minimally invasive medical procedures to help you get back to everyday activities. Tries to avoid heavy reliance. Interventional pain management tries to avoid heavy reliance on pain medications. Depending on any type of pain, your provider may recommend prescriptions or over-the-counter medications to relieve. Several types may help, including non-steroidal anti-inflammatories, aspirin and ibuprofen, acetaminophen, topical analgesics like lidocaine and capsaicin cream. Now, I did try the capsaicin in the winter because it's hot. It makes your body hot. So I haven't used it in the summer, but when it gets cool again, I'm going to start using those again. Anti-seizure medications like gabapentin and pregabalin, antidepressants like tricyclic antidepressants and SNRIs, muscle relaxers, corticoids, steroids, opioids. Healthcare providers typically aim to avoid the use of opioids when possible due to their high addiction potential. Clinical trials for pain management. Researchers are actively studying countless new pain management treatments for various causes of pain. Ask your provider if participating in a clinical trial is an option for you. Risks and benefits. What are the advantages of pain management? Let's go back here. Oh, Darth piercing. Yeah. She tried that. I've heard, yeah, she tried that. Her and her daughter both get migraines, and they both tried it, and it did not. I should stipulate that my friend not only has migraine, she also has a degenerative condition called Chiari malformation. So the Darth did not help her, but yeah, I've heard of that. Yeah. Let's see. Chronic pain is very complex. It can change the way your brain and nervous systems work and evolve over time. So, a comprehensive pain management approach led by experts is likely the best way to tackle it. It isn't always possible to find total relief from pain, but you may be able to reduce pain and learn to respond to it differently. Many people with chronic pain have a better quality of life with a pain management program and feel better physically and mentally. Studies show that current chronic pain treatments can result in about a 30% decrease in pain scores. What are the risks or complications of pain management? Different pain management approaches have their own risks, side effects, and complications, and these may vary from person to person based on other conditions you have or medications you take. Okay, for example, overuse of acetaminophen and over-the-counter medication is the most common cause of liver failure, and prescription opioids put you at risk for opioid use disorder. Surgeries are more invasive procedures have specific risks too, like infection and permanent nerve damage. Talk to your healthcare provider about the risks and benefits of each pain management therapy before starting it. Don't hesitate to ask questions. Your provider is there to help you, not judge you. And if you find that your provider is not helping you and is judging you, I recommend leaving that provider. How effective? Because I've been to providers like that and they don't help. And you should just move on and find a different doctor. How effective are pain management plans? Depending on the cause of pain and your unique characteristics, it may take time for several different therapies before you find the right approach that works for you. For example, less than 50% of people with neuropathic pain experience adequate pain relief with a single therapy. Your pain might not go away completely. Your pain management plan is more likely to be effective if you work closely with your provider or team and adjust the plan as your needs will change. When to call a doctor. When should I see my healthcare provider about pain management? See your provider if discomfort and pain are keeping you from enjoying your usual activities. Pain doesn't get better, worsens, or comes back after treatment. You feel anxious or depressed. You're having trouble sleeping because of pain. Yeah. Oh, and you know what? I'm reading it, but I haven't had it up, guys. I hope it's okay. I hope you've been following. Oh, no. Okay. I'm leaving in 5. Okay. As soon as I'm done with this, we're going to shut her down. Okay. What does it say? When to call your doctor. See your provider if discomfort and pain are keeping you from enjoying your usual activities. Pain doesn't get better, worsens, or comes back after treatment. You feel anxious or depressed. You're having trouble sleeping because of the pain. because we heal when we sleep, and if you can't get good sleep, it's hard to heal from anything. Living with pain can be extremely challenging, affecting nearly all aspects of your life. It may feel more like existing with pain than living. Most of us would try nearly anything to escape the nagging, relentless nature of chronic pain, but it can be overwhelming to know where to start, who to trust, and who will work for you. If you're in pain, talk to your healthcare provider about personalized pain management plan. Pain specialists are experts in their field and know various approaches to managing pain. It'll likely take more than one therapy to find some relief, but committing to the process may help you get back to enjoying life. And that is kind of all we can ask for is the arthritis pain isn't going to go away, but to manage it and to, but to manage it and to be able to do daily tasks with it is very helpful. Now I just see that we have 3 people in now, and I was going to shut it down here, but if you guys want to chat, we can chat for a minute about any type of pain management or and I wanted to do this because my a friend who has migraines, and I was talking with Michelle. She also has Chiari malformation, and they've just now recommended. She's had it for years, but it's gotten to the point where the migraines don't go away. They last longer than a day or a couple days, and so she's going to a pain management clinic, and I was curious to see like what type of pain management anybody here who goes to a pain clinic or what you use for pain management or just anything to inform us and tell us about what's going on. And yeah, so because she wasn't sure if that would be helpful. She doesn't think it's going to be helpful, but from what I'm reading now, it sounds like it can be helpful. And she's just tired and in a lot of pain. Yeah. Yeah. I can't imagine having a headache every day, all day. I can't imagine it. And she still goes to work, and she still helps her mom, and she still helps her daughter. And yeah, she does it all. And so it's getting to the point where she just can't take the pain anymore. So, yeah, if you have any thoughts or anything about pain management, I'd love to hear your opinions or if you've had a good result or even a bad result. Um, yeah, we've gone over all the AI stuff on Google, and we have gone over the Cleveland Clinic. And so, yeah, that's pretty much it for today. The nausea is starting to get better. The more water I'm drinking, I think, is helping. Because when we first started, man, it was. I shouldn't say anything because then it might come back. So, oh, Michelle says sometimes just talking about the pain is helpful, and they do recommend therapy. Therapy is part of that pain management. Those 4 steps, the 4 Ps. Um, and I agree that talking about anything, pain and anything else, having a third party unbiased who's not judging you in any way. I use some herbal supplements like passion flower and valerian, but I also just have migraines. Does that help with your migraines then? Because like I was telling you, my friend, she has an underlying condition as well. Um, so she's tried everything. She's tried the like we talked about the ear piercing. She's tried the Botox. She thought she was going to have surgery, but they don't want to do surgery on her. And she's like, that will make it better. And they're like, well, they've already done one surgery. They don't want to rush to do another surgery. So if this pain management doesn't help, I think then she might be having the surgery because when you have migraines, I don't know what kind of physical therapy they're going to put you through for your migraines. 40% of us are depleted in potassium and magnesium. Yeah, I take a magnesium supplement. so that I don't get cramps. And you know what I tried, Michelle? You may have tried this as well since we're chatting. I tried the coconut water and I cannot drink it. It's horrible. Do you have any suggestions? Have you tried coconut water before? It's got a lot of potassium in it and it has a little bit of sodium, but it's like coconut and salt. And I didn't. Now my niece made a drink with coconut water and it was good. It was some kind of a cooler or something. Maybe controversial, but a D worker. What's that? But a D worker as well. A DE worker. Um, yeah, so I was trying to get hydration that way. And I'm not a fan of the sports drinks. It's not that they don't taste good, but they have a lot of sugar in it. And I have to watch my sugar because I am diabetic, but my A1C is like 6.9. So I'm doing good. So I don't add extra sugar if I can avoid it. Like if I am craving a Coke, I'll have a little one. Could cause being nauseous. Oh, yeah. I can't coconut. I know it's just horrible. I haven't poured it out yet, but I'm thinking about it. It's no, it's just not. So I thought it would help, but as soon as I drank it, my stomach went, "Are you nuts?" But you could oil pulling. Is that good for dewormer? Oh, I've heard of that. Okay, people, yeah, yeah, it is controversial. Yeah, I gotcha. I gotcha. Yeah, I've seen the things online. I don't. They gross me out where the big tapeworm comes out and. Um, but the oil pulling, that's what you do with your teeth, right? My sister does that, and I've never really. Is it? I thought it was just for your teeth. Is it for other things as well? I mean, um, yeah. Okay, I'm gonna wrap it up because I think it's just me and Michelle here. Um, Thank you for coming. I appreciate you listening to me and everything. And I just haven't felt good. It's been over a week because it was last Wednesday too, and I don't know. It's allergy season. I don't know. Is there, you know? And then I did stop. There was one allergy medicine I stopped. I think I'm gonna put that back into my regimen tonight and see if that helps me feel any better. Because I'm praying it's not kidney stones. You just add coconut oil, a little in coffee. Oh, and then you just drink your coffee? Because I have coconut oil. I like it for skin treatments too. Your body will absorb the oil. Okay. Wonder if that will help with the acidity as well. Bye, Michelle. Bye, everybody. Bye. Have a great week. Oh, I won't be here next week. Bye, everybody. Bye.